The paired maxilla is the central bone of the facial skull, as it participates in the walls of the orbit, the nasal cavity, and the oral cavity as well through the hard palate. It has a body and 4 extensions called processes, and air-filled cavity within, which is the sinus maxillaris. The body has a 3-sided pyramid shape with its apex oriented laterally and its base oriented towards the nasal cavity, creating the lateral wall of the nasal cavity. Now, the surfaces or the faces are as follows. We have facies orbitalis, obviously inside the orbit, and then anteriorly we have facies anterior. The 2 surfaces are separated by the margo infraorbitalis here, and then the posterior surface is oriented towards the infratemporal fossa, so this area is called the infratemporal surface of the maxilla. The border between the anterior and infratemporal surfaces is this crista zygomatico-alveolaris, going all the way to the alveoli. Now, the extensions or processes are simple. They are named based on the bones they contact. So we have processus frontalis towards the frontal bone. We have processus zygomaticus towards the zygomatic bone. And inferiorly, we have the 2 other ones. The processus palatinus, the palatine process, obviously creates the hard palate's anterior 2 surfaces, processus palatinus, and then processus alveolaris practically is the area where the teeth are attached to the maxilla. The maxilla, examined as a separate bone, reveals all the details that pertain to it. So, as mentioned before, the maxilla has a body, some extensions, processes, and a maxillary sinus inside the body. This is a left-sided maxilla. For reference, I'm just gonna put here the skull. So this is the lateral view, and this is the anterior view, so that we have a reference of the position of the maxilla right there. Okay. Now, the body has we are looking at the body right now from behind. So the body has a triangular pyramid shape with a base oriented towards the nasal cavity and an apex oriented lateral towards the zygomatic bone. Then we have 3 surfaces to it: the superior orbital surface, then an anterior surface, and a posterior or infratemporal surface. The anterior surface has the following features. It will have a incisura nasalis, the big nasal notch that, together with the opposing maxilla, will create the so-called apertura piriformis, which is a pear-shaped opening, the anterior opening of the nasal cavity, of the bony nasal cavity. Then we will have the fossa incisiva, a small depression right above the incisors. We will have eminentia canina, the proeminence created by the root of the canine. Then fossa canina, which is a larger depression right above the canine proeminence. And obviously, above that, we will have the infraorbital opening, foramen infraorbitale, for communication with the orbital tunnel right there, or canalis infraorbitalis, sorry. This surface is separated from the orbital surface by the margo infraorbitalis, and from the infratemporal surface by the crista zygomatico-alveolaris, the zygomatico-alveolar crest. Now, posteriorly, as mentioned, we have the infratemporal surface, because it is part of the infratemporal fossa, with a protrusion, with a proeminent area we call tuber maxillae, on which we have some small openings we call foramina alveolaria. So on a bone we can see them. So this is one of them, foramina alveolaria, which, as you can see them here, which eventually contain the vascular nervous structures that go to the posterior teeth. Now, on the orbital surface, which is separated, as mentioned, from the anterior by the margo infraorbitalis, we have sulcus infraorbitalis going into canalis infraorbitalis and exiting through foramen infraorbitale. To demonstrate that, I'm going to use the bone, the articulated bone. As you can see here, by pushing through the marker, I demonstrate the foramen infraorbitale, canalis infraorbitalis right there, and it will continue or come from eventually sulcus infraorbitalis on the superior surface of the maxillary body. So these are the surfaces. Now the extensions, we have processus frontalis that is oriented towards the frontal bone, on which we have this crista lacrimalis anterior, the anterior lacrimal crest, and posterior to that we have the sulcus lacrimalis. On the medial surface of the frontal process, we have two bony crests, the crista ethmoidalis superiorly and crista conchalis inferiorly. Concha nasalis media is attached to the superior one, and concha nasalis inferior is attached to the inferior one. But now I remember that I didn't talk about the base of the maxillary body. So the base has the big opening we call hiatus maxillaris for the sinus maxillaris, the communication with the nasal cavity of the sinus. Obviously this is not that big in a living person because it is covered by many other bony parts, including the ethmoid parts and some of the inferior nasal turbinate. And anterior to hiatus maxillaris we will have the sulcus lacrimalis, which again, together with the concha nasalis inferior and the lacrimal bone up here, will be closed into canalis nasolacrimalis as mentioned before, for the communication with the nasal cavity. Now, returning to the processus frontalis, we have crista lacrimalis anterior here and sulcus lacrimalis posterior on the posterior side of the processus frontalis. Processus zygomaticus is the lateral extension that is connected, it's connected to the zygomatic bone. And then we have the last two important ones. We have here the processus palatinus and here the processus alveolaris. The processus palatinus is practically creating the heart pellets anterior 2/3 or even more of the heart pellet. It is eventually connected via a suture to the opposing processus palatinus of the opposing maxilla, and thus they create this anterior part of the palatine of the heart pellet with a inferior surface or oral surface and a superior surface or nasal surface. On the nasal surface we will have the crista nasalis viewed from superior and from posterior like so. This crista nasalis eventually will connect to the septum of the nose, the nasal septum, while anteriorly we will have this spine that ends in the spine, spina nasalis anterior, onto which the cartilaginous nasal septum connects. Now, on the inferior surface, we will have certain features that are not visible on the model, and those are the depressions, the sulci that are present here. We call them sulci arteriosi. They are practically holding the vascular nervous bundles that supply the heart pellet. Also, the two palatine processes are joined up in the midline via a suture, sutura palatina mediana, also including the posteriorly lying horizontal plates of the palatine bones, and they are also connected to the palatine bones posteriorly via sutura palatina transversa right here. And there is an important communication at the anterior part of the heart pellet towards the nasal cavity, which is pretty hard to go through, although I will try. So this is called canalis incisivus, and if we look in the nasal cavity, we can see that we have the two openings that are each for one of the nasal cavities. So it's a V-shaped tunnel that has a singular opening in the heart pellet, thus creating the communication between the heart pellet and the nasal cavity for a vascular nervous bundle. Then we have the last one, which is the processus palatinus. The processus palatinus is practically another processus alveolaris that holds the superior teeth. There are 8 depressions within the palatine, within the alveolar process. It has an internal plate and an external plate. And between these plates, we have separations that separate the alveoli from each other. Then we also call these proeminent areas of the alveolar process juga alveolaria outside here. Now, between the external and internal plates, we have these bony bridges that separate the alveoli from each other, and they are called septum interalveolare. They are separating the individual alveoli from each other. And also there are cases when the alveolus is subdivided into 2 or 3 based on the number of roots of the tooth. So we will have septum interradiculare as well right there, as you can see.